One of my main goals is to improve the quality of life of my patients. We are always using our feet. We are always putting weight on our feet and our ankles. And my goal is to treat my patients in a way that will help improve their quality of life, either by alleviating or decreasing the amount of pain that they have.
As a youth, I was injured in a fall, and over time calcium built up in the joint, and so about 16 years ago, OID had reconstructed the ankle. At that time, I knew that it would probably only be good for about 10 years, 10 to 12 years. It lasted 16, and when I began to have trouble again, I sought out medical attention. I wanted to come back to OID and have it done again. 7 weeks out from the surgery, the pain is gone. The pain that I did have was very well managed by Dr. Bishop. Dr. Bishop was very thorough in his diagnosis, which made it very easy for us to make choices, but we were always given the opportunity to choose what we wanted to do as a patient.
I want my patients to be educated about what their diagnosis is. In the field of medicine, there's often times where a patient does not fully understand their diagnosis or understand what the treatment protocol is. It is my goal as a physician to have my patients understand what I'm treating them with, how I'm treating them, and the reason that I am treating them. I encourage my patients to become more informed about their diagnosis. I spend a lot of time going over the diagnosis, the causes, the treatment, and what we can expect for the prognosis.
I fell off of a roof, and it was about 2 days after I fell that I went to the emergency room. They told me that I had some swelling. I need to go see an orthopedic doctor. I've had 3 previous leg surgeries, and because of that, I had a lot of fear and a lot of hesitation about going into surgery on my ankle. Talking to Dr. Bishop, he let me know exactly what was going to happen, and he told me in detail every bit of what surgery was going to entail and the recovery. And all of that fear was alleviated just in the amount of time and care that he took to sit down, talk to me, and explain everything to me.
One of the things I love about my job is that there's often people who come in and see me and they relate to me that they've had pain for several years or months, and nothing they have been able to do has improved the pain. And I love the opportunity to help decrease or alleviate the pain.
About a year ago, I had rolled my ankle walking in the yard with my daughters, and I pushed it off. I went to my own family doctor, and they kind of put me in a little ear cast, and says, "Oh, you'll be fine. You can walk on it in a week." And it rolled 6 more times. And the last time my ankle decided to give out, I was walking with my daughters down the road, and I went down on the ground and couldn't get back up. I wish I would have called Dr. Bishop sooner, because I know now everything dealing with him, he's a great doctor. He is got a great personality as well. He's got a great bedside manner and putting me at ease, and I probably wouldn't have had to go through so much the past year dealing with hurting myself as many times and injuring it as many times if I would have just went maybe the first or second time I did it.
Help these people feel better, help them walk better, help them run better, help them return to their normal activities without restriction or pain, or they no longer have to fight through the discomfort.
He is absolutely amazing. He takes care of his patients more than I've ever seen a doctor take care of a patient. Any questions, no matter how silly or ridiculous you may think they are, he will answer them, and it's just an absolutely wonderful experience from a doctor.
Patient-doctor relationships are the core of the treatment. Clearly he enjoys what he does, he's dedicated to it, he makes you feel at ease. It has been a very positive experience to work with him.